Alright, so here we go. This is Dr. Eric Su coming to you for my September video blog. And I wanted to get one housekeeping out of the way first before we go into my section. It's the September, school started. I can't believe it's school started already. The kids are having a great time. But I know that we often get forms from the school to complete their school physical or sports physical, vaccinations updated. So if you need all of that kind of stuff, please let us know ASAP so we can get started on it, so that your kid can go back to school without having them hassle you for it. Okay. Today I want to start kind of a new type of a video blog called the FAQs. A lot of patients come and ask me about a lot of questions that are not really medical, but what's going on here at the practice, what's going on in my head, what am I thinking, kind of you guys want to know what's going on between my head here. So let me talk about one thing that I get asked quite a bit is like, how did I get into aesthetic medicine, Dr. Sue? Why are you doing Botox and lasers? Are you doing it to make more money? Do you enjoy doing things like that, and so forth? So this all probably started back in 2005 when I started my own private practice, and I wanted to grow the business. I knew when I was seeing about 3 to 5 patients a day, I really had to try to come up with some marketing strategy to grow the business. Well, how am I going to grow the business? I knew I had to grow the business with a lot more women. Women tend to, bring their best friends, sisters, husbands, kids, mothers, best friends, and they are chit-chatty, and then they bring patients. My gosh, I could name about 3 or 4 of my patients who probably brought in like at least 10 or 15 patients themselves. So there are the networking people. So I wanted to grow with a lot more women because guys, come on, let's admit it. We don't talk about our health. If I got a physical, I'm not going to tell my best friend I got a physical or I had a health problem. We just don't talk about that. So growing the business with women was kind of a marketing strategy that I had. I also thought about like what other women are asking me a lot, and I will tell you a lot of my female patients have come in and asked me for a referral. And so I would say, what do you need a referral for? I want to get some Botox. My wrinkles are kind of getting deep, and my nasolabial folds are getting deep. So I would like a referral for that. I go, well, technically, you don't need to go see your dermatologist or plastic surgeon. I can do that for you. And so what I did was I went out and got trained. I went into a lot of classes and learned the facial anatomy and all this stuff about lasers and laser physics. And lo and behold, I started doing them. Got very good at it. So patients are coming in here and spreading the words, and again, that's how the aesthetic business kind of came about, which helped us to kind of grow. But I'll tell you this, aesthetic medicine is right now to our practice very, very essential. And the reason why that is that it is true, you do make more money doing Botox and lasers and things like that, 2, 3, 5 times more than seeing a medical patient. Now, the medical patient reimbursements are going down. Higher copay, higher deductible. A lot of patients don't even pay their bill anymore. Whole different story, but medical reimbursements are going down. And that's just the whole trend right now, right? So a lot of clinics are closing, a lot of doctors are retiring, a lot of the big hospitals are overtaking smaller hospitals, smaller clinics, and so forth. So we know that doing just pure medicine is no longer a viable solution for private physicians. You have to diversify somehow, which means you may have to sell supplements out of your clinic. You may have to do some Botox and lasers, which is a cash business, to supplement this medical side, which is not really carrying its weight anymore. Um, so a lot of times I would say this. I do my aesthetic medicine, which is about 20% of my business, to supplement my 80% of the business, which is medical. I still have to spend 15, 30 minutes with everyone that comes in and want to talk about their opiate addiction, or they're having depression, anxiety, if they're having to have some very tough life situations. I can't do that in 5, 10 minutes. I need to sit down and get to know them. It takes me 30 minutes, sometimes 45 minutes in a room with the patient. But I only get paid $60, $80, $100 at best for that time, which most physicians can't survive off of that. And that's why the primary care is not doing so well. So I just wanted to kind of let you know I'm still down in the trenches, helping patients almost every day. Aesthetic is a very small part of the practice that helps us supplement our income. So I wanted to kind of clear that out of the air, answer that questions for you guys, and hope you guys understand why we do what we do here. And if you have any other questions you want me to answer through the video blog, please let me know.